What if your daily medication could be silently reshaping the future of your child's mind? The Trump administration is poised to make a bold claim today. Acetaminophen, the active ingredient in Tylenol, might be linked to autism when taken during pregnancy. But here's where it gets controversial. This assertion clashes with decades of scientific consensus. Despite a lack of conclusive evidence, the administration plans to announce a groundbreaking and polarizing report, suggesting that a form of vitamin B used in cancer treatment could offer a solution. President Trump himself hinted at this revelation Sunday, calling it one of the biggest announcements medically in the history of our country. But is this a leap forward or a dangerous misstep? Let's unpack the facts and the firestorm brewing around them. Autism has long been a lightning rod for political and scientific debate. Health and Human Services Secretary Robert F. Kennedy Jr. has made it a personal mission, vowing to identify the cause by September and pointing fingers at everything from food dyes to vaccines. Now, acetaminophen is in the crosshairs. Yet, here's the twist. Autism diagnoses have tripled over 2 decades, but acetaminophen use during pregnancy has remained steady. Coincidence or a red herring? Scientists overwhelmingly agree that genetics play the dominant role in autism risk. If one identical twin has autism, the other often does too, suggesting biology, not behavior, is the key driver. The evidence for acetaminophen's role is murky. A few small studies hinted at a link between prenatal exposure and autism or ADHD, but the largest study to date, funded by the NIH and involving U.S. and Swedish researchers, found no correlation. Even before this study, a federal court dismissed a lawsuit linking Tylenol to autism in 2024, ruling there was no causal connection. Meanwhile, medical groups like the Society for Maternal-Fetal Medicine warn against ignoring acetaminophen's benefits. Untreated fevers in pregnancy can lead to miscarriage, birth defects, or premature labor. Is it worth risking a baby's health to chase a theory that hasn't held up under scrutiny? The administration's report also proposes using Leucovorin, a form of vitamin B, to treat or prevent autism. This idea stems from research showing some autistic individuals have metabolic issues that reduce folate availability in the brain. Leucovorin could bypass this block, but the evidence? Thin. Only 4 studies suggest low folate in pregnant women might raise autism risk, and even the Autism Science Foundation admits the science is very early stages. So why is this being pushed now? Critics argue it's part of a broader pattern, questioning vaccines, abortion medications, and more, undermining trust in science for political gain. And this is the part most people miss. The stakes go beyond Tylenol. If the administration's claims gain traction, could pregnant women face unnecessary fear and confusion? Could real treatments be sidelined in favor of unproven ones? The medical community is split. Some see potential in exploring new therapies. Others warn of misinformation's dangers. So we ask you, is this a groundbreaking discovery or a dangerous distraction from the real science? Share your thoughts below, because the conversation about autism, medicine, and truth is far from over.